to simply breathe. Let your body relax, let your mind quiet, and allow yourself to be fully present. Today, we're going to explore something foundational, yet often misunderstood. How to understand your skin type gently, without judgment, with curiosity and compassion. Understanding your skin type isn't about labeling yourself or fitting into rigid categories. It's about developing awareness of your skin's unique characteristics, needs, and patterns, so you can care for it in ways that truly serve it. This understanding is a gift you give yourself, a foundation for making choices that honor your skin rather than fighting against it. Let's begin by releasing any pressure or anxiety around this topic. Your skin type is not a verdict or a limitation. It's simply information. Whether your skin is oily, dry, combination, or sensitive, there's nothing wrong with it. Each skin type has its own beauty and its own needs. Your job isn't to change your skin type, it's to understand and support it. Now let's explore the main skin types gently, remembering that these are general categories and your skin might not fit perfectly into any one box. That's completely normal and fine. Let's start with oily skin. Oily skin produces more sebum, the natural oil your skin creates, than other skin types. If you have oily skin, you might notice your face looking shiny, especially in your T-zone, which is your forehead, nose, and chin. Your skin might feel greasy to the touch, particularly by midday. You might notice that your makeup tends to slide off or look shiny after a few hours. You may be more prone to enlarged pores, blackheads, and acne, because excess oil can mix with dead skin cells and clog pores. But here's something important. Oily skin isn't bad skin. Oily skin often ages more slowly because the natural oils provide protection and keep skin supple. People with oily skin frequently have fewer fine lines as they age. The oil that feels frustrating now is actually offering you benefits. If you have oily skin, your needs are centered around balance, not stripping. Many people with oily skin make the mistake of using harsh products to remove oil, which actually triggers more oil production as your skin tries to compensate. Instead, you need gentle cleansing, lightweight hydration, and products that support your skin's balance without disrupting it. Now let's consider dry skin. Dry skin produces less sebum than other skin types. If you have dry skin, you might notice your face feels tight, especially after cleansing. Your skin might look flaky or rough in texture. You might experience itchiness or discomfort. Fine lines may be more visible because dry skin doesn't have the plumping moisture that makes skin look smooth. Your skin might also be more sensitive to environmental factors like cold weather or low humidity. Dry skin needs gentle care that focuses on hydration and moisture retention. Rich, nourishing products that deliver water to your skin and seal it in are your friends. You want to support your skin's moisture barrier, which may be naturally weaker in dry skin types. It's important to distinguish between dry skin, a skin type that doesn't produce much oil, and dehydrated skin, which is a condition where skin lacks water. You can have oily skin that's dehydrated or dry skin that's well hydrated. Understanding this distinction helps you address the right issue with the right solutions. Let's explore combination skin. Combination skin is exactly what it sounds like, a combination of different characteristics in different areas. Typically, this means an oily T-zone with dry or normal cheeks. You might notice shine and larger pores on your forehead, nose, and chin, while your cheeks feel normal or even tight and dry. Combination skin can feel confusing because different areas seem to want different things. The key is finding balance. You don't necessarily need different products for different zones, though you can adjust if needed. Many people with combination skin do well with balanced, moderate products. Not too heavy, not too light, used all over. Remember that combination skin is extremely common. You're not difficult or complicated. Your skin just has varied characteristics, which is perfectly normal. Now, let's discuss sensitive skin. Sensitive skin isn't so much about oil production as it is about reactivity. If you have sensitive skin, you might notice redness easily, whether from products, temperature changes, or stress. Your skin might sting or burn when you apply certain products. You might experience irritation, itching, or rashes more easily than others. Your skin might react to fragrances, certain ingredients, or even changes in weather. Sensitive skin needs gentleness above all else. Minimal products with minimal ingredients. Fragrance-free formulas. Careful introduction of any new products. Patience and attentiveness to what triggers reactions. It's worth noting that sensitive skin can be a temporary condition caused by barrier damage, not necessarily an inherent skin type. If your skin has become sensitive after using harsh products or over-exfoliating, it may calm down once you repair your barrier with gentle care. There's also normal skin, sometimes called balanced skin. This is skin that doesn't tend toward excessive oiliness or dryness, doesn't react easily, and generally feels comfortable. If you have normal skin, consider yourself fortunate and focus on maintaining that balance with simple, consistent care. Now, how do you determine your skin type? Let's walk through this gently. The Cleanse Skin Test is a simple starting point. Wash your face with a gentle cleanser, pat it dry, and don't apply any products. Wait about an hour, then observe and gently touch your skin. How does it feel? How does it look? If your entire face feels tight and looks a bit dull or rough, you likely have dry skin. If your entire face looks shiny and feels oily, especially in your T-zone, you likely have oily skin. If your T-zone is shiny but your cheeks feel comfortable or slightly dry, you have combination skin. If your skin feels comfortable all over without being oily or tight, you likely have normal skin. The blotting paper test can also provide insight. About 2 or 3 hours after your normal morning routine, press a blotting paper against different areas of your face. Hold it up to the light. If you see substantial oil on the paper from all areas, you have oily skin. If you see oil only from your T-zone, you have combination skin. If you see little to no oil, you have dry or normal skin. Pay attention to how your skin behaves throughout the day. Does it get progressively shinier as hours pass? That suggests oily skin. Does it feel increasingly tight or uncomfortable? That suggests dry skin. Does it stay relatively comfortable? That suggests normal or well-balanced skin. Notice how your skin responds to products. Does it soak up rich creams and still want more? You likely have dry skin. Do heavy creams make you break out or feel greasy? You likely have oily skin. Do you react to many products with redness or stinging? You have sensitive skin. Consider seasonal variations. Your skin type can shift somewhat with seasons. You might have oily skin that becomes more combination in winter, or dry skin that becomes normal in humid summer months. This is natural. Your skincare routine can adapt slightly to these changes. It's important to understand that your skin type can change over time. Hormonal shifts, aging, climate changes, stress levels, and even medications can affect your skin's oil production and sensitivity. The skin type you had at 20 might not be the same at 40. Stay attentive and be willing to adjust your understanding and your routine.
Ovarian appearance on ultrasound. Baseline hormonal testing during the follicular phase, first 7 days of menstrual cycle, is standard because hormone levels are more stable and baseline during this phase. FSH and LH are assessed during the follicular phase. Progesterone is tested during the luteal phase, typically 7 to 8 days after ovulation, to confirm ovulation occurred. Testing hormone levels at the wrong cycle phase produces misleading results. Understanding test results requires expert interpretation because normal ranges vary widely and what's normal for general population might indicate androgen excess relative to individual baseline. A testosterone of 50 ING/DL is normal for most women but might represent significant elevation for a particular individual. Free testosterone is often more clinically relevant than total testosterone because it represents the active hormone, though measuring free testosterone is technically challenging and prone to error. Elevated DHAS, particularly if greater than 350 μg/dl, suggests adrenal androgen excess and warrants further adrenal evaluation. Elevated androstenedione suggests adrenal or ovarian androgen production. Elevated LH with normal or low FSH suggests ovulatory dysfunction characteristic of PCOS. If hormonal testing reveals significant androgen excess, additional testing might assess the source. Adrenal tumors or ovarian tumors very rarely cause acne but can cause very severe hyperandrogenism. Evaluating clinical presentation helps distinguish adrenal from ovarian sources. ACTH stimulation testing can differentiate adrenal from ovarian androgen excess if warranted. Interpreting results in clinical context is essential. You might have borderline elevated testosterone with classic hormonal acne, jawline breakouts, cyclical pattern, making hormonal treatment appropriate despite normal lab values. Conversely, you might have elevated testosterone labs without significant acne, making hormonal treatment unnecessary. Clinical presentation guides treatment more than isolated lab values. When to pursue hormonal evaluation: irregular or absent menstrual periods, acne with cyclical menstrual pattern, acne onset in adulthood, acne concentrated on jawline and lower face, acne resistant to standard treatments, signs of hyperandrogenism, hirsutism, hair loss, male pattern baldness, family history of PCOS or hormonal disorders, concerns about fertility. Other reasons to evaluate hormonal status. Additionally, pursuing evaluation before starting hormonal treatments gives baseline data to assess treatment effectiveness. Working with appropriate clinicians, gynecologists are ideal for hormonal evaluation in women, though some dermatologists also perform this evaluation. Reproductive endocrinologists specialize in hormonal disorders and are appropriate referrals for complex cases or PCOS evaluation. Family medicine physicians can perform initial evaluation. Choosing a clinician experienced in hormonal acne and PCOS improves evaluation quality. After hormonal evaluation, appropriate treatment depends on findings. If PCOS is confirmed, treatment includes hormonal contraceptives for acne and period regulation, spironolactone, antiandrogen, metformin for insulin resistance, and lifestyle modification. If adrenal androgen excess is identified, dexamethasone might be considered. If results are normal despite hormonal acne pattern, empirical hormonal treatment, oral contraceptive or spironolactone, remains appropriate despite normal labs. Timeline for hormonal treatment effectiveness is months, not weeks. Hormonal treatments typically require 3 to 6 months to show acne improvement, with maximal improvement often occurring after 6 to 12 months. Patience is necessary. Discontinuing hormonal treatment after 2 to 3 months before full benefits appear is a common mistake. Reassessment after hormonal treatment initiation is valuable. Repeating key hormonal tests, particularly free and total testosterone, after several months on hormonal treatment confirms that the treatment is achieving hormonal effects. If testosterone hasn't decreased despite hormonal treatment, investigating why, medication noncompliance, inadequate dosing, ineffective treatment choice, is appropriate. Guide 38, Dietary Supplements for Acne, Evidence-Based Review of Oral Supplements. Numerous dietary supplements are marketed for acne with varying levels of evidence. Understanding which supplements have evidence, realistic expectations for supplementation, and appropriate dosing guides inform decisions about supplementation. Zinc supplementation has evidence for acne improvement, particularly in individuals with zinc deficiency. Zinc supports immune function, wound healing, and inflammation reduction, all relevant to acne. Studies show that oral zinc at 30 to 50 mg daily improves acne moderately. However, excessive zinc supplementation, above 150 mg daily long-term, causes nausea and interferes with copper absorption. Typical zinc supplementation is 25 to 30 mg daily. Zinc is more effective for those with demonstrated zinc deficiency, though some people without deficiency also benefit. Blood zinc levels can be tested to assess zinc status, though zinc testing is not widely available. Vitamin D supplementation shows promise for acne. Vitamin D has immune and anti-inflammatory effects relevant to acne. Low vitamin D levels correlate with worse acne. Vitamin D supplementation at 1,000 to 400 IU daily might improve acne, particularly in those with low baseline levels. However, evidence is mixed, and benefits are modest. Vitamin D supplementation is generally safe and supports overall health beyond acne, making it reasonable to consider. B vitamins, particularly B5, pantothenic acid, are promoted for acne. Pantothenic acid is marketed at very high doses, 10 grams daily, claimed to reduce sebum production. While some small studies suggest benefit, evidence is weak. High-dose pantothenic acid causes diarrhea frequently and benefits aren't reliably demonstrated. Supplementation is not recommended without stronger evidence. Omega-3 fatty acids, fish oil supplementation, support anti-inflammatory effects and improve acne in some individuals. Omega-3s reduce systemic inflammation and support skin health. Typical supplementation is 1 to 2 grams daily of combined EPA and DHA. Fish oil supplementation is safe for most people, though it can cause mild gastrointestinal upset and rare interactions with blood thinners. Plant-based omega-3, ALA from flax or chia, is less effective than fish-derived EPA/DHA. Probiotics as oral supplements have mixed evidence for acne. While probiotics support gut health and might support skin through gut-skin axis mechanisms, specific acne benefits aren't reliably demonstrated. Some people report acne improvement with specific probiotic strains, but individual variation is substantial. If interested in probiotics, quality products with documented effective strains are preferable to low-quality products, though quality doesn't guarantee benefit. N-acetylcysteine supports glutathione production and has anti-inflammatory and antioxidant effects. Some evidence suggests NAC might improve inflammatory acne. Typical dosing is 600 to 1,200 mg daily. NAC is generally well tolerated, though some people experience gastrointestinal upset. Spironolactone supplementation is sometimes discussed, but spironolactone is a pharmaceutical medication, not a supplement, requiring prescription. This isn't applicable for over-the-counter supplementation. Saw palmetto is a botanical supplement claimed to reduce DHT and support acne. Evidence is limited and mostly from prostate health studies rather than acne-specific research. Acne-specific benefits aren't well established. Red clover contains isoflavones with weak estrogenic effects, claimed to reduce androgen activity and improve acne. However, evidence is limited. Additionally, red clover might interact with hormonal medications. Spearmint tea supplementation has some evidence for hormonal acne reduction through weak antiandrogenic effects. Drinking 2 cups of spearmint tea daily for several months might improve hormonal acne modestly in some women. This is one of the few plant-based approaches with dedicated acne research, though evidence is still limited. Licorice extract is promoted for anti-inflammatory effects. Topical licorice has some evidence for skin benefit, though oral licorice supplementation for acne lacks strong evidence. Additionally, chronic...
Hello and welcome to this calm, peaceful space. Take a moment to settle in, breathe deeply, and let any tension in your body soften. Today we're going to explore one of the most fundamental aspects of skincare, something so essential yet so often misunderstood: the importance of gentle cleansing. Cleansing is where your skincare journey begins and ends each day. It's the foundation upon which everything else is built. Yet despite its importance, cleansing is frequently done incorrectly, too harshly, too often, or with products that strip rather than cleanse. Let's change that together. First, let's understand what cleansing actually is and what it should accomplish. Cleansing is the process of removing impurities from your skin's surface. These impurities include dirt, environmental pollutants, excess oil, dead skin cells, makeup, and sunscreen. Throughout the day and night, all of these accumulate on your skin, and they need to be removed so your skin can function properly and absorb the beneficial products you apply afterward. But here's the crucial distinction. Cleansing should remove impurities without removing your skin's natural protective elements. Your skin has a delicate moisture barrier, a lipid layer that keeps water in and irritants out. It has a natural pH balance. It has beneficial microorganisms that form your skin's microbiome. Harsh cleansing disrupts all of these, leaving your skin vulnerable, irritated, and imbalanced. Think of your skin barrier like the walls of your home. You want to clean the walls, but you wouldn't use a power washer inside your house. That would damage the walls, strip the paint, and create more problems than it solves. The same principle applies to your skin. Gentle cleansing cleans effectively while preserving the integrity of your skin's protective structures. Let's talk about what gentle cleansing feels like. When you cleanse gently, your skin should feel clean and fresh afterward, but never tight, stripped, or squeaky. That squeaky clean feeling that many people associate with good cleansing is actually a sign of over-cleansing. It means you've removed too much of your skin's natural oils, disrupting your moisture barrier. After proper gentle cleansing, your skin should feel soft, comfortable and ready to receive moisturizer. There should be no stinging, burning, or excessive redness. Your skin might be slightly pink from the massage and warm water, but it should calm down within a few minutes. Now, let's discuss how to cleanse gently, step by step. Begin with the right water temperature. Many people use water that's far too hot, thinking it will open pores and clean more deeply. But hot water can actually damage your skin's protective barrier, cause broken capillaries, and strip away beneficial oils. Cold water, on the other hand, can be uncomfortable and doesn't allow cleansers to work effectively. The ideal temperature is lukewarm, warm enough to be comfortable and help dissolve oils, but not hot enough to cause damage. When you turn on the water, test it with your hand first. It should feel neutral against your skin, neither hot nor cold. This simple adjustment can make a significant difference in how your skin responds to cleansing. Next, choose a gentle cleanser. Look for products labeled as gentle, hydrating, or pH balanced. Avoid cleansers with harsh sulfates, which are the ingredients that create lots of foam but can also strip your skin. Avoid cleansers with alcohol high on the ingredient list. Avoid anything that feels drying or tight after use. The best cleanser for you is one that removes impurities but leaves your skin feeling comfortable. It might be a creamy cleanser, a gel cleanser, a cleansing oil, or a cleansing milk. The texture matters less than how your skin responds. If you have dry or sensitive skin, you'll likely prefer creamier formulas. If you have oily skin, you might prefer lighter gels. But these are guidelines, not rules. Trust your skin's feedback. When you apply your cleanser, use only a small amount, usually about the size of a nickel or quarter. You don't need a handful of product to cleanse effectively. In fact, using too much can make it harder to rinse completely and may leave residue on your skin. Apply the cleanser to damp skin, not dry skin. Dampen your face first with lukewarm water, then apply your cleanser. This helps the cleanser spread more easily and work more effectively. Now comes the actual cleansing process. Using your fingertips, massage the cleanser onto your skin using gentle circular motions. Don't scrub, don't pull, don't press hard. Just gentle rhythmic circles covering your entire face, your jawline, and down to your neck. Take your time with this massage. Aim for at least 60 seconds, perhaps even 2 minutes. This isn't wasted time, it's essential time. The gentle massage stimulates circulation, helps the cleanser break down impurities, and turns cleansing into a meditative practice. As you massage, breathe slowly and deeply. Feel the tension in your facial muscles release. This is self-care. Pay attention to areas where dirt and oil tend to accumulate, around your nose, your chin, your hairline, and behind your ears. But maintain that same gentle pressure everywhere. No area of your face needs aggressive scrubbing. If you wear makeup or sunscreen, you might benefit from the double cleansing method in the evening. The first cleanse uses an oil-based cleanser or cleansing balm to dissolve these products. The second cleanse uses your regular gentle cleanser to remove any remaining impurities. This two-step process ensures thorough cleansing without requiring harsh products or aggressive scrubbing. After massaging your cleanser for a minute or more, it's time to rinse. This step is just as important as the cleansing itself. Rinse thoroughly with lukewarm water, using your hands to splash water onto your face until every trace of cleanser is gone. Incomplete rinsing can leave residue that clogs pores and irritates skin. Many people rush the rinsing step, but it deserves the same attention and time as the cleansing. Take your time. Make sure your hairline is rinsed. Make sure your jaw and neck are rinsed. Make sure there's no cleanser left around your nose or in the creases beside your nose. Once you're confident all the cleanser is removed, splash your face with cool, not cold, water once or twice. This helps close your pores and feels refreshing. Then gently pat your face dry with a clean, soft towel. Pat, don't rub. Rubbing creates unnecessary friction and can irritate your skin, especially when it's damp and vulnerable. Now let's address one of the most common cleansing mistakes: over-cleansing. In our culture, there's often an assumption that more is better, that squeaky clean means truly clean. But with skin, this isn't true. Over-cleansing strips your skin of its natural protective oils, which then triggers your skin to produce even more oil to compensate. This creates a vicious cycle. You cleanse harshly because your skin is oily, but the harsh cleansing makes your skin produce more oil, so you cleanse even more harshly. The solution is to cleanse gently and trust the process. When you stop stripping your skin, it stops overproducing oil. It takes time, usually several weeks, for your skin to rebalance, but it will happen if you're patient and consistent with gentle cleansing. Most people only need to truly cleanse once or twice a day. In the morning, many people can simply rinse with water, especially if they have dry or sensitive skin. In the evening, cleanse thoroughly to remove the day's accumulation. If you exercise or sweat during the day, you might cleanse after your workout. But beyond that, additional cleansing is usually unnecessary and potentially harmful. Let's talk about cleansing tools. Washcloths, cleansing brushes, sponges. There are countless tools marketed for facial cleansing. Do you need them? Welcome and breathe with me, in and out. Let any stress or frustration melt away for this moment. We're going to talk about acne today, not with judgment or harsh criticism, but with compassion, understanding, and practical wisdom. If you're dealing with acne, first, know this: you're not alone. You're not doing anything wrong, and your skin doesn't define your worth. Acne is incredibly common. It affects people of all ages, not just teenagers. It can be influenced by hormones, stress, genetics, and countless other factors, many of which are beyond your control. Let's approach acne treatment the way we approach all skincare, with gentleness, patience, and respect for your skin's natural processes. First, let's understand what acne actually is. Acne forms when your pores become clogged with oil, dead skin cells, and bacteria. Your skin naturally produces oil through sebaceous glands. This oil, called sebum, is actually beneficial. It moisturizes your skin and protects it. But when too much oil is produced, or when dead skin cells don't shed properly, they can combine to create a plug in your pore. This is where the trouble begins. Bacteria that normally live on your skin can multiply in this clogged pore, leading to inflammation, redness, and the formation of pimples. There are different types of acne. Whiteheads and blackheads are non-inflammatory. They're simply clogged pores without significant infection or swelling. Papules, pustules, nodules, and cysts are inflammatory. They're red, swollen, often painful, and involve bacterial infection and immune response. Understanding what type of acne you have helps guide treatment, but the fundamental approach remains the same. Be gentle, be consistent, and be patient. Let's talk about the most important principle in treating acne: gentleness. When you have acne, it's tempting to scrub hard, to use strong products, to try to force your skin to be clear. This is understandable, but counterproductive. Harsh treatment actually makes acne worse by irritating your skin, damaging its protective barrier, and triggering more oil production as your skin tries to compensate for the damage. Gentle treatment, on the other hand, helps your skin heal, maintains its barrier function, and allows effective ingredients to work without causing additional inflammation. Start with a gentle cleanser, the same type we've discussed before. Nothing harsh, nothing with scrubbing beads or gritty texture. Just a simple pH-balanced cleanser used twice daily. Cleanse in the morning and at night, using lukewarm water and gentle circular motions with your fingertips. This removes excess oil and impurities without traumatizing your skin. After cleansing, this is where acne treatment comes in. There are several effective ingredients for treating acne. Let's discuss the most common and accessible ones. Salicylic acid is a beta-hydroxy acid that can penetrate into your pores and help dissolve the mixture of oil and dead skin cells that causes clogs. It's excellent for blackheads and whiteheads. Start with a product containing 2% salicylic acid. This is the sweet spot for effectiveness without excessive irritation. You can find salicylic acid in cleansers, toners, serums, and spot treatments. Benzoyl peroxide kills acne-causing bacteria and helps remove dead skin cells. It's particularly effective for inflammatory acne, those red, swollen pimples. Start with 2.5% concentration. Studies show that lower concentrations are just as effective as higher ones, but cause less irritation. You can always increase if needed, but begin gently. Niacinamide is a form of vitamin B3 that reduces inflammation, regulates oil production, and helps fade post-acne marks. It's gentle and suitable for all skin types. Look for products with 5 to 10% niacinamide. This ingredient plays well with others and is an excellent addition to any acne routine. Retinoids derived from vitamin A are powerful for preventing clogged pores and speeding up skin cell turnover. Over-the-counter retinol is available in various strengths. For prescription-strength retinoids, you'll need to see a dermatologist. Start with a low concentration and use only a few times per week at first, gradually increasing frequency as your skin adjusts. Here's how to build a simple, effective acne routine. Morning. Cleanse gently. Apply a product with niacinamide or salicylic acid. Follow with a lightweight, oil-free moisturizer. Finish with sunscreen. This is crucial because some acne treatments make your skin more sensitive to the sun, and sun exposure can darken acne marks. Evening. Cleanse gently. Apply your acne treatment. This might be benzoyl peroxide, a retinoid, or salicylic acid. Wait a few minutes for it to absorb. Follow with moisturizer. Notice that moisturizer appears in both routines. Even oily, acne-prone skin needs moisture. When your skin is dehydrated, it actually produces more oil to compensate. Moisturizer helps maintain your skin's barrier function, which is essential for healing. Choose an oil-free, non-comedogenic moisturizer that won't clog your pores. Now let's address what not to do. These are common mistakes that can make acne worse. Don't pick, pop, or squeeze your pimples. This is perhaps the hardest rule to follow because the urge to pick is strong, especially when a pimple is right there on your face. But picking introduces bacteria from your fingers, causes trauma that leads to scarring, spreads infection to surrounding skin, and prolongs healing time. When you feel the urge to pick, take a deep breath. Apply a spot treatment instead. Occupy your hands with something else. Put a small hydrocolloid patch over the pimple if you can't resist touching it. Don't use multiple harsh products at once. It's tempting to throw everything at your acne. Salicylic acid, benzoyl peroxide, retinoids, strong acids, all at the same time. This will only irritate and damage your skin. Choose 1 or 2 active ingredients and use them consistently. You can combine products, but do so thoughtfully. For example, salicylic acid in the morning and retinoid at night is a common, effective combination. But using 3 strong products all at once will likely cause redness, peeling, and actually worsen your acne. Don't expect instant results. This is crucial to understand. Acne treatment takes time. You won't see significant improvement for at least 4 to 6 weeks, sometimes longer. Your skin needs time to turn over, for clogged pores to clear, for inflammation to reduce. Consistency over weeks and months is what produces results, not intensity over days. Let's talk about lifestyle factors, because acne isn't only about what you put on your skin. Stress affects acne significantly. When you're stressed, your body produces more cortisol, which can increase oil production and inflammation. While you can't eliminate stress entirely, managing it through breathing exercises, adequate sleep, gentle exercise, and activities you enjoy can help improve your skin. The connection between stress and acne is real and significant. Sleep matters. During sleep, your body repairs and regenerates, including your skin. Poor sleep disrupts this process and can worsen acne. Aim for 7 to 9 hours of quality sleep. Keep your bedroom cool and dark. Change your pillowcase regularly. Once or twice a week is ideal because pillowcases accumulate oil and bacteria. Diet's role in acne is debated, but certain patterns emerge in research. High glycemic foods, sugary, processed foods may worsen acne for some people. Dairy, particularly skim milk, has been linked to acne in some studies. However, diet doesn't affect everyone's acne equally. Pay attention to your own patterns. If you notice your skin worsens after certain foods, it's worth adjusting your diet. But don't restrict yourself unnecessarily or blame your diet entirely. Acne is complex and multifactorial. Stay hydrated. Water supports every system in your body, including your skin's ability to heal and maintain its barrier. Aim for adequate water intake throughout the day. Now let's address the emotional impact of acne, because this is just as important as the physical treatment. Acne can affect your self-esteem, your confidence, your comfort in social situations. These feelings are valid and real. You're not being vain or superficial for caring about your skin. Be kind to yourself. Speak to yourself the way you would speak to a dear friend struggling with the same issue. Your worth isn't determined by your skin's clarity. You're valuable, worthy, and deserving of love and respect, regardless of whether you have acne. When you look in the mirror, try to see your whole self, not just your skin. Notice your eyes, your smile, your unique features. Acne is temporary. It will improve with consistent care. But you are so much more than your skin. If acne is severely impacting your quality of life, causing painful cysts, or not responding to over-the-counter treatments, please see a dermatologist. There's no shame in seeking professional help. Dermatologists have access to prescription-strength treatments that can make a significant difference. You don't have to suffer or struggle alone. For acne scarring and marks, be patient. Red or dark marks left after pimples heal will fade with time, usually several months. Sunscreen is crucial for preventing these marks from darkening. Ingredients like niacinamide, vitamin C, and retinoids can help speed up fading. True depressed or raised scars may require professional treatments like chemical peels, microneedling, or laser therapy. But wait until your active acne is well controlled before pursuing these options. As we come to the close of our time together, remember these core principles. Be gentle with your skin. Use effective ingredients consistently but not harshly. Give treatments time to work, at least 6 to 8 weeks. Moisturize even though you have oily skin. Protect your skin with sunscreen. Don't pick or squeeze. Manage stress and care for your overall well-being. And above all, be patient and kind with yourself. Acne is frustrating, but it's treatable. With consistency, gentleness, and time, your skin can improve. The routine we've discussed isn't complicated or expensive. It's simple, sustainable, and effective. Take a deep breath in and release. You have everything you need to care for your acne-prone skin with gentleness and effectiveness. May your skin heal. May you have patience with the process. May you treat yourself with the same compassion you'd offer to anyone you love. Thank you for this time together. Be well, be gentle, and trust the process.
Appearance-related anxiety helps reframe negative thoughts about acne, reducing anxiety and depression related to appearance. Specialized dermatology (CBT) combines skin condition understanding with psychological techniques for optimal outcomes. Acceptance and commitment therapy (ACT) helps people accept current skin status while committing to valued activities despite appearance concerns. This approach reduces appearance-focused anxiety while maintaining motivation for treatment. Body image work addressing distorted thinking about appearance supports mental health alongside medical treatment. Body dysmorphic disorder screening is important for those with disproportionate appearance distress. Mindfulness practices reduce appearance-focused anxiety and rumination, supporting mental health during treatment. Dermatology apps using AI analyze skin photos to assess acne severity, identify acne types, and recommend treatments. While some apps show reasonable accuracy for basic assessments, they can't match professional dermatologists for complex cases. These apps serve best as supplements to professional care rather than replacements. Accuracy of AI skin analysis varies. Higher quality apps with larger training datasets and professional validation generally perform better than those lacking proper development. However, all AI assessments have limitations and should be verified by professionals. Personalization algorithms use your skin characteristics, responses to past treatments, and various data points to recommend optimized treatment approaches. As these systems improve and accumulate more treatment outcome data, personalization effectiveness likely improves. Currently, these tools remain supplements to professional judgment rather than replacements. Telemedicine AI-assisted dermatology allows remote consultations where AI supplements the dermatologist's assessment. This can improve access to dermatology for people without nearby specialists. Privacy considerations are important with AI skincare apps. Your skin data is sensitive. Understanding how your data is used and stored matters when choosing AI tools. Guide 44: Peptide Therapies and Bioidentical Hormone Treatments. Advanced peptide therapies and bioidentical hormone treatments represent frontier approaches for acne management. Understanding these options helps you discuss them with your healthcare provider. Specific peptides stimulate collagen production and support skin barrier healing. For acne management, peptides primarily support post-acne recovery and scar treatment rather than treating active acne directly. Peptides appear in many premium skincare products. Bioidentical hormone replacement therapy, BHRT, uses hormones chemically identical to your body's natural hormones. For hormonal acne, bioidentical estrogen and progesterone might theoretically provide benefits similar to synthetic hormones in oral contraceptives with theoretically better tolerability. However, evidence for BHRT's superiority for hormonal acne is limited. Additionally, BHRT is more expensive and requires more individualized monitoring than standard hormonal contraceptives. Compounded bioidentical hormone prescriptions allow customization of hormone dosing and ratios. For severe hormonal acne, compounded BHRT might be appropriate, though professional oversight is essential. Guide 45. Nanotechnology in acne treatment. Nanotechnology enables delivery of active ingredients at microscopic scale for potentially enhanced effectiveness. Understanding nanodelivery systems helps you evaluate next-generation acne products. Liposomal formulations encapsulate active ingredients in microscopic lipid spheres, enabling enhanced penetration and stability. Liposomal retinol or liposomal benzoyl peroxide potentially provide enhanced effectiveness with reduced irritation through optimized delivery. Products using liposomal technology are increasingly available commercially. Nanoparticles of active ingredients increase surface area and bioavailability, potentially enhancing effectiveness. Nano-sized acne actives are being researched for enhanced skin penetration and efficacy. Sustained-release nanotechnology enables gradual release of actives over extended periods, potentially maintaining consistent therapeutic levels with less frequent application. Guide 46. Environmental and climate adaptation strategies for acne. Acne management must adapt to different climates and environmental conditions. Understanding climate-specific strategies optimizes treatment across varying conditions. Tropical climates with heat and humidity increase sebum production and bacterial growth. Strategies include more frequent cleansing, lighter formulations, focus on oil control, increased sun protection. Sun worsens heat-related acne, air conditioning when possible, and increased frequency of active acne treatments. Guide 50. Acne success stories, effective patterns, and realistic timelines for clear skin. Examining successful acne treatment patterns and realistic timelines helps set expectations and maintain motivation during treatment journeys. Most people achieve significant acne improvement, 70 to 80% clearing, within 12 weeks with appropriate treatment. Complete clearance often takes 4 to 6 months. Severe acne or scarring might require 6 to 12 months or longer. Successful patterns often involve early professional intervention for moderate severe acne, combination approaches addressing multiple acne factors, consistent routine adherence, lifestyle optimization alongside treatments, patience through initial adaptation phases, and adjustment of treatments based on response. Common obstacles in achieving success include unrealistic expectations for overnight results, giving up after 4 to 6 weeks before full benefits appear, switching treatments too frequently before adequate trial period, neglecting lifestyle factors, inconsistent treatment adherence, and failing to pursue professional help when home treatment insufficient. Inspiring success often involves recognizing that clear skin is achievable through consistent, appropriate treatment. Most acne-prone individuals can achieve clear or nearly clear skin through proper dermatological care combined with appropriate skincare and lifestyle optimization. The ultimate lesson: acne is treatable. Whether your path involves topical treatments, professional treatments, hormonal interventions, or isotretinoin, solutions exist for your specific acne. Finding the right approach for your individual situation, maintaining patience and consistency, and persisting through initial difficulties. 50 Specialized Skin Care and Acne Treatment Guides, Part 4. Each guide, 10 to 15 minutes reading time. Guide 51, Acne During Menstrual Cycle, Tracking, Prediction, and Strategic Treatment Timing. Understanding how your menstrual cycle affects acne allows you to predict breakouts and strategically time treatments for maximum effectiveness. This is particularly valuable for women with cyclical hormonal acne. The menstrual cycle consists of phases with distinct hormonal profiles affecting acne. The menstrual phase, days 1 to 5, involves shedding of uterine lining with declining hormone levels. Many women experience least acne during this phase as hormones are low. The follicular phase, days 6 to 14, involves increasing estrogen as follicles develop. Estrogen rise typically improves skin as estrogen has protective effects. Many women notice clearest skin during this phase. Ovulation, day 14, involves.
Welcome to this gentle healing space. Take a slow, calming breath. Today we're exploring how to reduce acne marks over time, those stubborn spots that remain after breakouts heal. With patience and gentle care, these marks can fade significantly. Acne marks, also called post-inflammatory hyperpigmentation, or PIH, are dark spots left behind after acne heals. They're not scars. They're areas where inflammation triggered excess melanin production. The good news is that these marks are temporary and will fade on their own, though you can support and accelerate this process. Understanding the difference between marks and scars is important. Acne marks are flat discolorations, brown, red, or purple, depending on your skin tone. Acne scars involve textural changes, indentations, raised areas, or tissue damage. Marks fade with time and proper care. Scars typically require professional treatment. Today we're focusing on marks. The most important step in reducing acne marks is preventing new ones. This means treating active acne gently to minimize inflammation, never picking or squeezing pimples, which increases inflammation and darkening, and protecting your skin from sun exposure, which darkens marks significantly. Sun protection is absolutely crucial for fading acne marks. UV exposure triggers melanin production, making marks darker and slowing fading dramatically. Wear broad-spectrum SPF 30 or higher every single day, even when indoors or when it's cloudy. Reapply if you're outside for extended periods. Without consistent sun protection, other treatments will be far less effective. Now let's discuss treatments that support mark fading. Several ingredients have been proven to help fade hyperpigmentation safely and effectively. Vitamin C is a powerful antioxidant that inhibits melanin production and brightens skin. Use a serum with 10–20% L-ascorbic acid, the most effective form. Apply it in the morning under moisturizer and sunscreen for antioxidant protection throughout the day. Be patient. Vitamin C takes several weeks to show visible results. Niacinamide reduces inflammation, which prevents marks from forming and helps fade existing marks by inhibiting melanin transfer. A serum or moisturizer with 5 to 10% niacinamide can be used twice daily and works well with other ingredients. Alpha hydroxy acids like glycolic or lactic acid exfoliate surface layers, encouraging cell turnover that gradually removes pigmented cells. Start with 5 to 8% concentration 2 or 3 times weekly. As your skin builds tolerance, you can increase frequency. Always use AHAs in the evening and be diligent with sun protection the next day. Azelaic acid addresses both active acne and marks simultaneously. It has antibacterial properties and inhibits melanin production. A treatment with 10 to 20% azelaic acid can be used once or twice daily. Retinoids accelerate cell turnover, bringing fresher, less pigmented cells to the surface while preventing new pigmentation. Over-the-counter adapalene or prescription tretinoin used consistently over months significantly fades marks. Start slowly, 2 to 3 times weekly, and build tolerance. Always use retinoids at night with thorough sun protection the next day. Kojic acid, licorice root extract, and arbutin are natural ingredients that inhibit melanin production. Look for serums containing these ingredients. They're gentle and can be used daily. Tranexamic acid is a newer ingredient showing promise for fading hyperpigmentation. Products with 2 to 5% tranexamic acid can be incorporated into your routine. Layer these ingredients thoughtfully. A common effective routine: morning, vitamin C serum, niacinamide moisturizer, sunscreen; evening, cleanser, AHA or retinoid, niacinamide moisturizer. Don't use all actives at once. Choose 2 to 3 that work for your skin and use them consistently. Rotation works well. AHA one night, retinoid the next. Rest day, repeat. Be patient. Acne marks take time to fade, typically 3 to 6 months for significant improvement, sometimes up to a year for complete fading. Consistency matters more than intensity. Gentle, regular use of effective ingredients will fade marks over time. Professional treatments can accelerate fading if home care isn't sufficient. Chemical peels performed by professionals provide deeper exfoliation. Microneedling stimulates collagen production and can help fade marks. Laser treatments target pigmentation specifically, but can be expensive and require downtime. Discuss these options with a dermatologist if you're interested. Professional treatments combined with good home care give the best results. Lifestyle factors affect mark fading. Manage inflammation by reducing stress, getting adequate sleep, eating anti-inflammatory foods, and staying hydrated. Less inflammation during healing means less dark marking. Be extremely gentle with active breakouts. Never pick or squeeze. This dramatically increases inflammation and resultant dark marks. If a pimple needs draining, use clean tools, minimal pressure, and immediately apply spot treatment. Keep your skin well moisturized. Healthy, hydrated skin repairs and renews itself more effectively than dry, compromised skin. Certain skin tones are more prone to post-inflammatory hyperpigmentation, particularly darker skin tones with more melanin. If you have darker skin, be especially vigilant about sun protection and gentle acne treatment. The principles are the same, but the importance is amplified. Avoid harsh treatments that could cause more inflammation and thus more marks. Be cautious with strong peels, aggressive exfoliation, or irritating ingredients. Gentle, consistent care works better than aggressive treatment for fading marks. Understand that complete fading takes time measured in months, not days or weeks. Set realistic expectations. Significant lightening in 3 to 6 months is success. Don't expect miraculous overnight results. They don't exist. Take photos monthly to track progress. Day-to-day changes are imperceptible, but monthly comparisons show the gradual fading occurring. Stay consistent even when progress feels slow. The treatments work cumulatively. Every day of gentle care, sun protection, and appropriate treatments is contributing to fading, even when you can't see immediate results. As we close, remember, acne marks are temporary. With patience, protection, and gentle encouragement through effective ingredients, they will fade. Your skin knows how to heal and renew itself. Support it consistently and trust the process. May your marks fade gently and completely. May you have patience for the healing timeline. May your skin become clear and even. Thank you for this time together. Trust the fading process. Welcome to this caring moment. Breathe deeply, feeling your body relax. Today we discuss caring for your skin after pimple extraction, how to support healing and prevent scarring after a blemish has been drained. Sometimes, despite our best intentions not to touch breakouts, a pimple comes to a head and needs to be drained, or you've had professional extraction. Proper aftercare is crucial for healing without infection, inflammation, or scarring. First, understand what happens when a pimple is extracted. Whether open naturally or manually, extraction creates a small wound. The protective skin barrier is breached, leaving the area vulnerable to infection and inflammation. Your immediate care in the hours and days following extraction significantly affects healing outcomes. Immediately after extraction, the priority is cleanliness and protection. If you've just extracted a pimple at home, immediately cleanse your hands and the affected area with gentle cleanser and lukewarm water. Pat dry very gently with a clean towel or tissue. Apply an antibacterial spot treatment. Benzoyl peroxide at 2.5% kills bacteria that could infect the open pore. Alternatively, use a spot treatment with salicylic acid or a dab of antibiotic ointment. Apply carefully just to the extracted area. Consider applying a hydrocolloid bandage or acne patch over the extracted pimple. These serve multiple purposes. They protect the wound from touching and bacteria, absorb any remaining fluid, create a moist, healing environment that reduces scarring risk, and prevent you from touching the area again. Leave the hydrocolloid patch on for several hours or overnight. When you remove it, you'll often see that it's absorbed additional fluid, continuing the clearing process. For the first 24 to 48 hours after extraction, be extremely gentle with the area. Don't apply makeup over it if possible. Don't touch it. Don't pick at any scab that forms. Scabs are your skin's natural bandage, and removing them increases scarring risk. Cleanse your face gently once daily, being extra careful around the extracted area. Use your regular gentle cleanser with fingertips only. Pat dry carefully. Continue applying spot treatment and/or hydrocolloid patches until the area has closed and begun healing. This typically takes 2 to 5 days depending on the size and depth of the original pimple. Once the wound has closed, usually after a few days, you can begin supporting healing and preventing scarring. Keep the area well moisturized. Hydrated skin heals better and faster than dry skin. Apply your regular moisturizer over the healing area. Protect the area from sun exposure vigilantly. UV radiation can darken healing skin, creating post-inflammatory hyperpigmentation that lasts for months. Apply sunscreen carefully over the area every day. Consider using a zinc oxide-based spot treatment that provides both sun protection and healing support. After a week or so, when the area has healed over but may still be red or dark, you can begin using ingredients that support scar prevention and fade any darkening. Vitamin C serum helps brighten post-inflammatory marks and supports collagen production. Apply carefully to the healing area once or twice daily. Niacinamide reduces inflammation and helps prevent excess pigmentation. A serum or moisturizer with 5% niacinamide can be applied to the healing area twice daily. Once the area is fully healed with intact skin, usually after 1 to 2 weeks, you can carefully use gentle exfoliants to help fade any remaining mark. AHAs like glycolic acid at 5 to 8% concentration used 2 to 3 times weekly help remove pigmented surface cells. Retinoids support cell turnover and collagen production, helping heal marks faster. Wait until the area is completely healed before applying retinoids, then use them carefully 2 to 4 times weekly. What not to do after extraction. Don't pick at scabs or peeling skin. This dramatically increases scarring risk and can reintroduce infection. Don't apply harsh treatments hoping to speed healing. Aggressive products cause more inflammation and delay healing. Don't cover with heavy, pore-clogging makeup immediately. If you must cover it, use light, non-comedogenic mineral makeup and remove it thoroughly in the evening. Don't expose healing skin to sun without protection. This causes darkening that can last for months. Don't extract the same area again.
Caffeine and alcohol intake timing affects sleep quality. Caffeine consumed in the afternoon or evening disrupts sleep onset and quality. Alcohol consumption in the evening worsens sleep quality even though it might initially make you drowsy. Avoiding caffeine after 2 p.m. and limiting evening alcohol consumption improves sleep. Exercise supports both sleep quality and acne management through multiple mechanisms. Regular aerobic exercise, 30 minutes, 5 times weekly, improves sleep quality, reduces stress, regulates hormones, and improves acne. However, exercising too close to bedtime, within 3 hours, might disrupt sleep. Exercising earlier in the day optimizes both sleep and acne benefits. Sleep-specific skincare involves protective measures during sleep. Applying a heavy, occlusive moisturizer or night cream before bed protects skin during nighttime and supports barrier health. Night creams are often richer than daytime moisturizers because you don't need to worry about appearance or mattifying for makeup. Overnight hydrating masks provide intense hydration during sleep. Some people use occlusive oils, just a few drops of facial oil over moisturizer, to lock in maximum hydration overnight. Retinoid application at night leverages sleep's restorative processes. Applying retinoids in the evening, or before bed if your routine allows, means they work while your skin undergoes growth and repair during sleep. This timing often provides better results than morning retinoid application, though this varies individually. Acne spot treatments can be applied before bed to work overnight without interfering with daytime activities. Leaving benzoyl peroxide or other treatments on overnight provides extended contact time for therapeutic benefit. Silk or satin sleep masks or pillowcases are promoted for anti-aging and acne benefits. The reduced friction might slightly reduce acne, and the reduced moisture absorption compared to cotton might help slightly, but these effects are modest compared to other acne management strategies. If you like the feel of silk pillowcases and can afford them, they're worth trying, but they're not necessary for acne management. Optimizing sleep requires a multifaceted approach, maintaining 7 to 9 hours nightly, keeping consistent sleep schedules, avoiding evening screen use, limiting caffeine after 2 p.m., maintaining cool, moderate humidity bedroom, and changing pillowcases frequently. These changes take 2 to 3 weeks to impact acne, but most people notice significant improvement in acne after optimizing sleep long-term. Sleep is one of the most underrated acne management strategies. While topical treatments and professional treatments receive most attention, sleep optimization often provides dramatic acne improvement that rivals pharmaceutical treatments. Prioritizing sleep is one of the highest impact acne management strategies available. Guide 35, Water Quality, Hydration Science, and Optimal Water Intake for Clear Skin. While drink water for clear skin is commonly repeated, the mechanisms behind water's role in skin health and the specific amount of water actually needed for acne improvement are often misunderstood. Understanding water science and optimal hydration supports acne management. The myth that specific water quantities, 8 glasses daily, etc., directly treat acne is oversimplified. While adequate hydration supports overall health and skin function, consuming excessive water beyond your actual hydration needs doesn't further improve acne. However, maintaining proper hydration throughout the day supports skin health in multiple ways. Dehydration compromises skin barrier function. When your body is dehydrated, your skin compensates by producing more sebum to maintain oil barrier protection. Paradoxically, dehydrated acne-prone skin often appears oily while being dehydrated internally, creating conditions promoting acne. Proper hydration reduces this compensatory sebum production. Hydration supports skin cell function. Skin cells require water to function optimally. Proper hydration maintains cellular processes, supports detoxification, and promotes overall skin health. Dehydrated skin appears duller and is more prone to irritation and breakouts. Hydration supports immune function. Adequate hydration maintains lymphatic function and immune cell circulation, supporting your body's ability to fight acne-causing bacteria. Dehydration compromises immune function, potentially worsening acne. Hydration supports blood circulation. Well-hydrated blood flows more efficiently, delivering nutrients and oxygen to skin cells. Dehydration compromises circulation, reducing nutrient delivery to skin. Optimal daily water intake varies based on body weight, activity level, climate, and individual factors. A general guideline is 35 milliliters per kilogram of body weight daily. For a 70 kilograms person, this equals approximately 2.5 liters, about 10 glasses, daily. However, individual needs vary significantly. Thirst is a reasonable indicator of hydration needs. Drinking when thirsty and monitoring urine color. Pale yellow indicates adequate hydration, dark yellow suggests dehydration, guides appropriate intake. Individual variation in optimal water intake is substantial. Some people need 2 liters daily for optimal hydration, while others need 3 to 4 liters depending on activity and climate. Rather than following a rigid 8 glasses recommendation, assess your personal hydration status and drink accordingly. Water intake timing matters somewhat. Distributing water intake throughout the day maintains consistent hydration better than consuming large amounts at once. However, excessive water intake shortly before bed disrupts sleep through nighttime urination. Tapers off water intake 2 to 3 hours before bed to optimize sleep quality. Electrolyte balance matters for hydration beyond pure water intake. Excessive water intake without sufficient electrolyte intake, sodium, potassium, magnesium, can disrupt electrolyte balance, causing problems. Consuming electrolyte-containing beverages or foods alongside water maintains balance. However, the Western diet typically contains adequate sodium, so electrolyte concerns are minimal for most people unless they're exercising extensively or sweating significantly. Water quality affects skin and acne through multiple mechanisms. Hard water, high mineral content, leaves mineral buildup on skin, potentially irritating it and compromising cleansing efficacy. Soft water cleanses more effectively. If you have very hard water, installing a water softener or using a shower filter might help. However, evidence for hard water directly worsening acne is limited. Chlorinated water can irritate acne-prone skin. Chlorine is drying and potentially irritating. Using filtered water for cleansing if you have highly chlorinated tap water might help. However, most chlorine in tap water is minimal and unlikely to significantly impact acne. Hot water is more drying to skin than lukewarm or cool water. Cleansing with lukewarm water rather than hot water reduces water-related dryness, particularly important for acne-prone skin already potentially compromised by active treatments. Distilled water versus tap water has minimal practical difference for skin health. Distilled water is free of minerals and chlorine but also lacks beneficial minerals.
Welcome and settle in. Breathe. Today we explore facial mists and sprays, those lightweight, refreshing products that can hydrate, soothe, and revive your skin throughout the day. Facial mists seem simple, almost too simple to be effective, yet they serve real purposes and can enhance your skincare routine and daily comfort. Let's understand what they do, when they're useful, and how to choose and use them effectively. What are facial mists? Facial mists are liquid formulations packaged in spray bottles, designed to be spritzed onto your face. They contain water and various beneficial ingredients depending on their purpose: hydrating agents, soothing botanicals, antioxidants, or refreshing extracts. The mist format allows light, even application without disturbing makeup, without touching your face with your hands, and with minimal effort. It's quick, convenient, and portable. Types of facial mists. Hydrating mists focus on adding moisture to your skin. They contain humectants like hyaluronic acid, glycerin, or aloe vera that attract and hold water. These are excellent for dry, dehydrated, or tight-feeling skin. Soothing mists contain calming ingredients like chamomile, Centella asiatica, rose water, or green tea. They help reduce redness, calm irritation, and comfort stressed skin. Toning mists function like liquid toners, balancing skin pH after cleansing and prepping skin for subsequent products. Some contain gentle exfoliants or clarifying ingredients. Setting sprays are designed for use after makeup application to help makeup last longer. While marketed differently, they're essentially facial mists with film-forming ingredients. Thermal water sprays contain mineral-rich water from specific springs. They're simple, just water with naturally occurring minerals, but can be soothing and refreshing. Benefits of using facial mists. Instant Hydration Boost provides immediate relief for tight, dry, or dehydrated skin. The fine mist delivers water directly to your skin's surface. Refreshing sensation wakes up tired skin and provides a cooling, reviving feeling. This is particularly welcome in hot weather, after exercise, or during long flights. Convenience is major. No sink needed, no hands needed beyond holding the bottle. You can mist anywhere, anytime. Makeup-friendly application allows hydration without disturbing your makeup. Misting over makeup sets it and adds a dewy finish. They help other products absorb better. Misting before applying serums or moisturizers to damp skin can enhance absorption. They're portable and travel-friendly, perfect for keeping in your purse, desk drawer, or carry-on luggage. Midday Skin Rescue revives skin that feels dry, tight, or tired hours after your morning routine. When to use facial mists. After cleansing, to add moisture before applying toner, serum, and moisturizer. This helps subsequent products absorb better into damp skin. Before moisturizer, to dampen your skin, making your moisturizer more effective. Humectants and moisturizers work better on damp skin. Over makeup to set it, add a dewy finish or refresh your look midday without disturbing makeup. Throughout the day, whenever your skin feels dry, tight, or tired. In air-conditioned offices, during flights, in heated indoor spaces, or outdoors in dry weather. Post-workout to cool down and refresh your face after exercise, before cleansing. After sun exposure, to cool and soothe skin that feels warm or irritated. Before bed, over your nighttime products to add an extra hydration layer. Choosing the right mist. For hydration, look for hyaluronic acid, glycerin, or sodium PCA. These powerful humectants draw moisture into your skin. For soothing and calming, choose ingredients like rose water, chamomile, allantoin, Centella asiatica, or cucumber extract. For oily skin, look for lightweight, oil-free formulas, possibly with niacinamide or green tea to help control oil. For sensitive skin, choose fragrance-free options with minimal ingredients. Simple thermal water or pure aloe vera mists work well. For makeup setting, look for products specifically labeled as setting sprays with film-forming ingredients that help makeup last. Avoid mists with high alcohol content, which can be drying and irritating despite the initial cooling sensation. Check ingredients for potential irritants if you have sensitive skin. Fragrance, essential oils, and some botanical extracts can cause reactions in susceptible individuals. How to use facial mists effectively. Hold the bottle 6 to 10 inches from your face. Too close and you get droplets that run off. Too far and you get uneven coverage. Close your eyes and mouth and spray in a sweeping motion across your face. Usually 2 to 3 sprays cover your entire face. Let the mist settle on your skin for a moment, then gently pat it in with clean hands. Don't let it fully air dry, which can actually pull moisture from your skin as the water evaporates. If using before other products, wait just a moment for skin to absorb some moisture. Keeping it damp, then apply your next product. If using over makeup, hold slightly farther away and use a very light mist to avoid disturbing makeup. Throughout the day, mist as needed. There's no limit. If your skin feels good with frequent misting and isn't becoming irritated, mist away. Common mistakes with facial mists. Letting mist air dry completely can leave skin drier than before. Water evaporating from your skin can draw moisture out. Always pat in or follow with moisturizer. Using mist as your only moisturizer won't provide adequate hydration. Mists add water but don't prevent water loss. You still need moisturizer to seal in hydration. Spraying too close creates droplets that run off rather than misting your face evenly. Using alcohol-heavy mists repeatedly throughout the day can dry and irritate skin despite feeling temporarily refreshing. Expecting mist to dramatically transform skin leads to disappointment. They're supportive additions, not miracle workers. DIY versus commercial mists. You can make simple mists at home with distilled water in a spray bottle. Add a few drops of glycerin or aloe vera gel for hydration. Keep refrigerated and use within a week. Rose water or witch hazel, alcohol-free, in spray bottles make simple DIY mists. However, commercial mists often contain stabilizers, preservatives, and carefully formulated ingredient blends that provide better stability and effectiveness than simple DIY versions. If you enjoy DIY, start simple and keep preparations refrigerated. If you want convenience and sophisticated formulations, commercial options are worth the investment. Special situations for mists. Airplane travel is where mists shine. Cabin air is extremely dry. Misting every hour during long flights helps combat this harsh environment. Choose a small bottle that meets TSA requirements. Hot weather makes mists delightful for instant cooling. Keep mist in the refrigerator for extra refreshing sensation. Office environments with air conditioning or heating can dry skin throughout the day. A desk mist provides relief. Post-procedure or irritated skin benefits from soothing mists. After professional treatments, sunburn, or reactions, gentle misting can calm and comfort. Realistic expectations. Facial mists provide genuine benefits, but within reasonable limits. They add temporary surface hydration, they soothe and refresh, they help other products work better when used correctly. They won't deeply moisturize very dry skin alone. They won't cure skin conditions. They won't eliminate wrinkles or dramatically brighten skin. What they will do is make your skin more comfortable throughout the day, provide convenient hydration boosts, and enhance your overall skincare routine when used as supplements to a proper routine, not replacements for it. Budget considerations. Some facial mists are expensive luxury items. Others are quite affordable. Effectiveness doesn't always correlate with price. Thermal water sprays from fancy French springs are lovely but expensive. Regular distilled water with a good humectant works almost as well for a fraction of the cost. Read ingredient lists. If you're paying premium prices, ensure you're getting premium ingredients, not just premium packaging. That said, if a particular mist brings you joy and you can afford it, that joy itself has value. We're not robots seeking only maximum cost efficiency. Environmental considerations. Aerosol sprays raise environmental concerns. Many brands now offer non-aerosol pump spray bottles that are more eco-friendly. Consider refillable options if available. Some brands sell refills, reducing packaging waste. As we close, remember that facial mists are helpful additions to skincare routines, not essential necessities. They enhance comfort, provide convenient hydration, and can make skincare more enjoyable. If you've never tried facial mists, experiment with one to see if you enjoy it. Many people discover that misting becomes a favorite self-care moment throughout their day. A quick pause to refresh and care for themselves. If mists don't appeal to you or don't seem to benefit your skin, that's perfectly fine. Not everyone needs every type of product. Your basic routine, cleansing, treating, moisturizing, protecting, matters far more than any mist. Take a deep breath in and out. You now understand facial mists and how they might serve you. May you find refreshment in these small acts of care throughout your day. May your skin feel comfortable and hydrated. May you give yourself permission for moments of self-attention and kindness. Thank you for this peaceful time together. Mist with joy, refresh with intention, and carry comfort with you always. Hello and welcome to this peaceful moment. Take a deep breath in and gently release it. Let yourself settle into this comfortable space where we'll explore together one of skincare's most beloved ingredients, vitamin C. Vitamin C is often called the gold standard of brightening ingredients, and for good reason. It's one of the most researched, most effective, and most versatile ingredients in skincare. Yet it can also be one of the most confusing. Today, we'll gently unravel the mystery of vitamin C, helping you understand what it does, why it matters, and how to use it wisely. Let's begin by understanding what vitamin C actually is and why your skin needs it. Vitamin C, also known as ascorbic acid in its pure form, is a powerful antioxidant. Your body needs vitamin C for many functions, including the production of collagen, the protein that gives your skin its structure, firmness, and elasticity. While you can get vitamin C through your diet, applying it directly to your skin provides targeted benefits that eating vitamin C alone cannot achieve. Think of vitamin C as a multitasker for your skin. It doesn't just do one thing, it works in several important ways simultaneously. First, vitamin C is a potent antioxidant. Every day, your skin faces oxidative stress from environmental aggressors, UV radiation, pollution, cigarette smoke, and even the natural metabolic processes in your cells. These create free radicals, unstable molecules that damage your skin cells, break down collagen, and accelerate aging. Vitamin C neutralizes these free radicals before they can cause damage. It's like having a protective shield around your skin cells. Second, vitamin C brightens your complexion. It does this in two ways. It inhibits the enzyme tyrosinase, which is responsible for melanin production, and it can help fade existing dark spots and hyperpigmentation. This doesn't mean vitamin C bleaches your skin or changes your natural skin tone. Instead, it helps even out discoloration, reduces the appearance of sunspots and post-inflammatory hyperpigmentation from acne, and gives your skin a more radiant, luminous appearance. Third, vitamin C boosts collagen production. As we age, our bodies produce less collagen naturally. This leads to fine lines, wrinkles, and loss of firmness. Vitamin C is essential for the enzymes that build collagen. By ensuring your skin has adequate vitamin C, you're supporting your skin's ability to maintain its structure and resilience. Fourth, vitamin C enhances sun protection. Now let me be clear. Vitamin C is not a sunscreen and should never replace sunscreen. However, when used alongside sunscreen, vitamin C provides additional protection against UV damage. It helps neutralize free radicals generated by sun exposure and can help repair some of the damage that occurs despite sunscreen use. Now that you understand what vitamin C does, let's talk about the different forms of vitamin C you'll encounter in skincare products. Pure vitamin C, or L-ascorbic acid, is the most researched and most potent form. It's also the most unstable. L-ascorbic acid is water-soluble and highly reactive. It oxidizes easily when exposed to air, light, or water, turning from clear to yellow or brown. Once oxidized, it loses its effectiveness and can even become irritating to skin. This instability is why vitamin C serums often come in dark bottles with dropper tops, to minimize exposure to air and light. It's also why you'll sometimes hear that vitamin C products should be stored in the refrigerator. For L-ascorbic acid to be effective, it needs to be formulated at the right pH, ideally between 2.5 and 3.5, and at the right concentration, typically between 10% and 20%. Lower concentrations may not provide significant benefits, while higher concentrations don't necessarily work better and may cause irritation. Because pure L-ascorbic acid can be irritating, especially for sensitive skin, many products use vitamin C derivatives instead. These are modified forms of vitamin C that are more stable and gentler on skin. Common derivatives include magnesium ascorbyl phosphate, ascorbyl glucoside, sodium ascorbyl phosphate, and tetrahexyl decyl ascorbate. These derivatives need to be converted by your skin into L-ascorbic acid to work, which means they may be less potent than pure vitamin C. However, they're also more stable, less irritating, and still provide meaningful benefits. There's no best form of vitamin C for everyone. The right choice depends on your skin type, sensitivity level, and specific concerns. If you have resilient skin and want maximum brightening and anti-aging benefits, pure L-ascorbic acid at 15–20% concentration might be ideal. If you have sensitive skin or are new to vitamin C, starting with a lower concentration, around 10%, or a derivative form would be gentler. Now, let's talk about how to incorporate vitamin C into your routine. Vitamin C serums are typically applied in the morning, right after cleansing and before moisturizer and sunscreen. The reason for morning application is that vitamin C works synergistically with sunscreen, providing extra antioxidant protection throughout the day when your skin faces the most environmental stress. Apply vitamin C to clean, dry skin. Use 3 to 4 drops for your entire face. You don't need much. Gently press it into your skin rather than rubbing vigorously. Give it a minute to absorb before applying your next product. Some people prefer to apply vitamin C at night, and that's fine too. The most important thing is consistency, using it regularly, whether morning or night. When you first start using vitamin C, you might experience some tingling or slight redness. This is common, especially with pure L-ascorbic acid formulations. The tingling should be brief and mild. If it's intense, or if you experience burning, stinging, or prolonged redness, the product may be too strong for your skin. Start slowly. Use vitamin C just once or twice a week initially, then gradually increase frequency as your skin builds tolerance. Most people can eventually use it daily. Be aware of potential interactions. Vitamin C can be used with most other skincare ingredients, but there are a few combinations to approach carefully. Vitamin C and retinol can be used together, but many people find this combination too irritating, especially when starting out. If you want to use both, consider using vitamin C in the morning and retinol at night. Alternatively, use them on alternate days. There's some debate about whether niacinamide and vitamin C can be used together. Older research suggested they shouldn't be combined, but more recent studies show they work fine together. If you have sensitive skin, you might prefer to separate them, but most people can use both in the same routine without issues. Avoid using vitamin C immediately after exfoliating acids, AHAs or BHAs. The low pH of acids can increase vitamin C's potential for irritation. If using both, apply acids first, wait a few minutes, then apply vitamin C, or use them at different times of day. Always use vitamin C with sunscreen during the day. Vitamin C helps protect against UV damage, but it's not a substitute for sunscreen. Let's talk about results and realistic expectations. Vitamin C works, but it's not instant magic. With consistent use, most people begin noticing a brighter, more radiant complexion within 2 to 4 weeks. Fading of dark spots and improvement in fine lines takes longer, typically 8 to 12 weeks of daily use. The key word is consistent. Using vitamin C occasionally won't give you meaningful results. This is a long-term investment in your skin's health. Some important considerations about storing and choosing vitamin C products. Always check the packaging and expiration date. Once opened, most vitamin C serums remain effective for about 3 to 6 months, though this varies by formulation. Store your vitamin C in a cool, dark place. The bathroom cabinet is fine. You don't necessarily need to refrigerate it unless the product instructions specifically say so. Watch for signs of oxidation. If your clear vitamin C serum turns yellow or brown, it's oxidized and should be replaced. Some vitamin C products are naturally yellow or orange. That's fine. What you're watching for is a change in color. If a product seems off, smells strange, has separated, or has changed texture, don't use it. Now let's address some common concerns and questions. My skin is sensitive. Can I use vitamin C? Yes, but choose carefully. Look for vitamin C derivatives rather than pure L-ascorbic acid and start with lower concentrations. Introduce it slowly and pay attention to your skin's response. I have acne-prone skin. Will vitamin C break me out? Vitamin C itself doesn't cause acne. However, the vehicle it's formulated in might. If you're acne-prone, choose lightweight, non-comedogenic serums rather than heavy cream formulations. Can I use vitamin C if I'm pregnant or breastfeeding? Topical vitamin C is generally considered safe during pregnancy and breastfeeding. However, always consult your healthcare provider about any skincare products during pregnancy. I'm not seeing results. What am I doing wrong? Results take time. Ensure you're using the product consistently, storing it properly, and using enough concentration to be effective. Also, make sure you're pairing it with sunscreen. Sun exposure can counteract vitamin C's brightening effects. As we come to the end of our time together, remember that vitamin C is a powerful ally for your skin, but it's not magic. It works best as part of a complete routine that includes gentle cleansing, adequate moisturization, and diligent sun protection. Choose a formulation that suits your skin type and sensitivity level. Store it properly to maintain its effectiveness. Use it consistently. Be patient with results. And always, always wear sunscreen. Your skin has the wisdom to respond to good ingredients when given time and consistency. Vitamin C offers that skin protection from oxidative stress, support for collagen production, and that beautiful, healthy radiance we all desire. Take a deep breath in and release it slowly. You now understand vitamin C.